Okay, thank you all for joining us today. You will notice that this meeting is being recorded, and we will send out the recording and any materials after the webinar has concluded. But I'm very excited to bring in our friends from Thatch today. I'm going to kick it over to Gary Daniels to get us started, and he'll take it from there. Welcome, everybody, and welcome, Gary.
Yeah, good afternoon, everyone. We're really excited to come in and talk a little bit about what's been happening in the ICHRA space. I'm sure a lot of you, maybe you've heard of ICHRA or may recently heard of ICHRA, but it's a rapidly evolving environment, and specifically for not just small business but all business. It's a pretty dynamic opportunity in terms of how people purchase their healthcare. And so just a little bit of background. So I'm the Chief Growth Officer for Thatch. I've been at Thatch for only a few months. I spent the 15 years prior to that with United Healthcare. Most recently, the last 5+ years, I was the CEO for United Healthcare in the Pacific Northwest. A lot of the way that we went to market in the Northwest was through chambers and association health plans. So very familiar with how chambers work and operate and provide guidance to local business. And really the way that we're positioning the presentations for all of our chamber relationships across the country is to be very educational. There's a lot of, platforms, and there's a lot of movement around what this space is going to look like. And the tack that we've taken is we want to be very educational to you guys, let you kind of poke and prod, ask lots of questions, not just about like what is ICHRA and how do we think it's going to fundamentally change healthcare, but also from a legislation and policy perspective, because that's probably changing faster at this point than ICHRA itself. So with that, Patricia, will you go and introduce yourself really quickly, and then we'll pass it over to Bruce.
Hi, everyone. My name is Patricia, and I'm a product manager here at Thatch. I've been at the company for almost 3 years now and worked across different parts of our segments. I've worked with our businesses, large and small, and including our broker partners as well. And so very excited to be here and to be having this conversation.
Hey everyone, my name is Bruce Johnson. I'm head of policy at Thatch. I joined the company in February with a focus on helping to drive some of the public policy changes that would really expand access to affordable coverage, including through ICHRAs and lower costs for employers. Really excited to talk about some of the recent developments. Some of you may have been tracking, but there's a great deal of benefits coming through the pipeline, both at the state and federal level, that would support those small businesses who are seeking to offer healthcare for the first time through an ICHRA. Excited to talk to you all today.
So fantastic. So we try to operate however you guys want to do around communication. If you have questions, I'm sure you'll have a lot of them. Feel free just to ask a question, or you guys can put it in the chat and we'll try to answer those as we move forward. So Bruce, we go to the first slide. So just a little bit of foundational stuff. Not so much just around like who we are at Thatch, but you'll start to like learn that this is a very new topic. It's a complete change from like an employer-based solution, which has always been kind of the delivery of healthcare, to more of a defined contribution. We'll talk about that, what that means, which is really more about individual decision making. And what we've done as an organization at Thatch was to really build what I would say is an infrastructure. And you'll see that infrastructure come to life when Patricia does her demo, because as much as we could talk about this like on slide decks and everything else, it's very different to see how we may come to life ICHRA in terms of being able to help individuals shop for individual health insurance, not just in the state of Illinois, but across the entire country. And the way that we were able to do that is really we were born out of what I would say was a bunch of really smart fintech engineers and data scientists that said, we know that the healthcare space is all transactional problems, so billing, reconciliation, and claims, and all of that is really is our transactional issues. And so our DNA as a company is very different in the sense that I was like the first insurance guy or second insurance guy that was hired into the company. And my role is really to see like how do we facilitate this movement from a group environment that we're all used to operating in terms of how we purchase health insurance, the way we think about our incentive models, the way we work with agents, the way that we support our businesses and our community, to a model that's really focused on the employer just giving a contribution to the employee and allowing them to purchase their own health insurance, and how do we support them and how do we manage that end-to-end process. So foundationally, to be able to do that on a national scale is really, really difficult. And you'll see that come to life when Patricia presents later on today. Slide. So I'll give it just a couple brief examples. I think Bruce and I only have a handful of slides here. But really there's a couple of great ways to think about ICHRA. And one of the easiest ways for people to kind of comprehend it is to think about the old world of pensions and how you moved into 401k plans. And that's very similar to the way the group market is today. The employer goes out and shops and purchases the health insurance on behalf of the employees. The employees really have no decision making within that process. And really what ICHRA is where the employees receive funds for their employer, a defined contribution. We'll talk a little bit more about what that means and how it works. And then they go and purchase health insurance on their own, which is also what we do at Thatch, is that facilitation to help them know like what providers in the individual health insurance for that particular geography for their own family. And so it's a very similar concept and scale. But Bruce, do you want to give a little bit of background in terms of how ICHRA legislation was kind of born anyway in the first Trump administration?
Yes, and so this was really born out of an executive order during the early part of Trump's initial term to get the agencies to develop rules that would expand the use of health reimbursement arrangements and other insurance tools that employees might find useful for meeting their healthcare needs. And part of the reasoning behind it was to help control some of the costs associated with some of the federal premiums that are afforded to individuals in the individual market. Um, ICHRAs are essentially a benefits type that builds upon evolution since the passage of the Affordable Care Act, and in this case, driving folks to employer-sponsored plans that still allow them the flexibility of choosing their own healthcare in the individual market. And so we'll talk a little bit about what the next phase of this benefits package looks like when we get into the policy discussion.
Perfect. So just a little bit, we'll talk a little bit about what defined contribution is and isn't, but essentially what happens in the defined contribution space from an employer perspective, instead of again going out and working with a broker and shopping for group insurance and kind of making those decisions, instead what you do is you set a defined contribution amount. So you set a fixed amount of money for each one of your employees. And we'll talk a little bit about the difference between what we refer to as dynamic contribution, which you'll see live with Patricia, versus what we refer to as flat dollar. And dynamic, which is with a majority, we have about 1,100 employers on our platform at Thatch, which takes into account a little bit more equity. So, for example, if you have an employee that's 55 in Illinois, versus an employee that's 27 and living in South Florida, those premiums are dramatically different. So if you give everyone the same $1,000, the purchasing power of the individual in Illinois is going to not have the same type of purchasing power. And so we have the ability to dynamically change those contributions so both employees can actually afford the same type $1,000 PPO plan, even though they're in dramatically different states and counties and obviously conditions. And so this idea of setting dollar amounts versus trying to go out and purchase entire benefit plans is completely different than the way things have been operating today. The other thing that happens within the ICHRA space is this entire, what I would say is kind of curated ecosystem. So we make it really easy for employers to see all of the different benefit offerings for each individual employee across the entire country in real time. And so, one of the things that we've been very cognizant about is that employers want to make sure that they offer still quality benefits, quality access. What they don't want to do is just give a fixed set of money and walk away. They still want to make sure that their employees are taken care of. And that's where this comes into in terms of our transparency around what those market looks like today. And then behind the scenes, the ICHRA companies kind of manage everything. They manage all the billing and reconciliation on behalf of the individual. And it becomes a completely, I would say, kind of disjointed process from the way group insurance works today, where HR kind of handles everything and there's lots of hand holding, and they deal with, claim issues and billing issues. All of that is dealt with by the ICHRA vendor. And one of the biggest advantages, as Bruce was talking about, is that you're not negotiating group renewals every single year, is that you think more long term about your business strategy. And so, if you set a defined contribution one year of maybe $1,000 and you want to say, I'm going to increase that by, 5% or 7%, or, however you think you want to think about your contributions as a business owner, you're not burdened by waiting on your renewals and figuring out what happens when you get a 20 or 25% rate increase. And so it's a very different mindset in terms of how businesses can operate within the benefits space. Next slide, Bruce. So we talked a little bit about the defined contribution. Again, you'll see this kind of come to life later on. The other big thing that happens within the ICHRA space is that we can class out for roughly 11 different classes. So we think about full-time, part-time, different hourly sets. And so originally, I think the thought process is that ICHRA was going to be more of a small business type of philosophy. And as we've gotten more sophisticated on not just us, but all ICHRA platforms about classes and management, our fastest growing segment right now is 51 to 1,000. We're actually writing more self-funded groups than we probably ever anticipated. And that's because our ability to control these classes and allow individual decision making has really empowered some of these groups to come back into more of a defined contribution strategy. And then obviously, we do a lot of counseling with our groups. A lot of them haven't thought about class structures, and especially when you get into the defined contribution aspect of it, and you'll see Patricia kind of play with it. We can do some really dynamic stuff on behalf of our employers in terms of how they think about, pricing and giving contributions by these different classes of employees. So just a 10,000 foot visual for what it looks like as an employee. And I'm sure at some point we'll do a follow-up if this group would like around the entire employee aspect in terms of how they go through the decision making. But at a 10,000 foot level, employee they get their defined contribution. In this case, for this young lady, it's $750. And then she goes out and purchases her own health insurance. And so part of what we do at Thatch is we facilitate that entire experience. And so this young lady would get a link from Thatch. She would log into our platform. She would type in some information that's important to her, like what doctors that she wants to be able to see. Does she care if she has a high deductible plan, low deductible plan? And then we bring to life in real time all of the individual plans that are available to her and what the cost is in her particular location. The amazing thing about ICHRA is that, say this young lady only spends $500 on her health insurance because she finds a plan that she thinks she likes. She gets to pick between United or Blue Cross or Oscar over Aetna, maybe because she has a brand affinity, but she picks the plan that she likes. In this case, she has an additional $250 a month that she can spend on whatever she wants around a healthcare journey. And so it can be anywhere from spending additional money on prescriptions, paying for co-pays. But the most interesting thing I think that we've learned at Thatch is that people like to spend additional money on things like infertility. So we have a partnership with Cara Infertility. Especially young people are buying up additional mental behavioral health services. So we have an entire platform where individuals can go out and buy additional healthcare services. This one has Hims and Hers. You can buy an Aura ring. There's all kinds of stuff that these members can buy that is based on their own individual healthcare journey. So again, very different than the group model historically. And I think the wildest thing that we're seeing in these renewals is that once individuals have been on an ICHRA for 1 year, because typically they come into an ICHRA, they try to shop by deductible versus what they currently have with their employer. And the second year of the renewal, we're seeing members dramatically buy down their deductibles and out of pocket because they either know they don't have a lot of healthcare costs, they feel comfortable with the type of risk they're taking on. But more importantly, they like to take those additional dollars that they're not spending on health insurance premiums and they're buying additional stuff around their own personal journey that they think is valuable to them. And I can't see if there's any questions in the chat yet. Bruce, did you see anything in there?
Not
I
yet.
don't see questions here.
Perfect. All right, and I have one more slide, and we'll kick it over to Bruce here. So for the employer again, and this isn't unique to Thatch, a lot of them, we do everything from the enrollments, the compliance, the renewals, the COBRA notices. Again, think about like a full end-to-end solution that takes off all of that burden off the employer. The other thing that's really important that the ICHRA companies are doing, and specifically us as Thatch, is making sure the employer knows where all of their employees are enrolling and the types of plans that they're selecting. Because again, it's one thing to say we're going to give employees money and then they can go and make their own decisions. That's something they've never had to do before for the most part. And so the way that we handhold and the way that we communicate between if you have a broker that you work with, the employer, in terms of the HR team, and then being able to help members in real time as they go through their journey, they can actually, if they're struggling on a platform in terms of how to like make a decision around a product, they actually can click on a calendar that's a part of our platform and we will have a live discussion with them about how they can pick their plan and what they should be thinking about in terms of kind of their costs and their deductibles and co-insurance. So it's a truly unique model. Again, this is only a few years old, and so if it's very unfamiliar to you guys, don't be caught off guard by that. But it's a very unique construct to think about the end consumer, the end employee first versus starting with the employer.
So uh, this is a time when there is a lot of policymaker focus on ICHRAs as a tool, again, for helping to reduce some of the cost burdens on the federal government, particularly, but also on state budgets when it comes to either folks being uninsured or reliant on government subsidies for access to healthcare. And so both the state and federal governments have been looking at ways to further incentivize the adoption of ICHRAs, particularly among small businesses. You see here in a chart that lists some of the state tax credits and the federal tax credits that are currently either enacted or proposed or pending before various legislatures. Indiana was the first state to enact a ICHRA tax credit. That was in 2023. And this year, other states followed. Georgia, Texas, Ohio all have introduced legislation, Mississippi as well. We're also seeing a major move on the part of the federal government to kind of follow suit in the same direction many states are going by offering a federal version of state tax credit, or excuse me, the tax credit. Now, as you all may fully appreciate, the state and federal tax credits can be used together. The state tax credits offsetting state tax liability and the federal tax credits offsetting federal. So if this passes, especially at the federal level, then you can see multiplying value happening for employers that have employees in the states that have taken a similar approach by offering credit. Now, we of course would love to see Illinois jump on the train with some of the other Great Lakes states that are considering or have implemented a tax credit. But I think what we see will drive more engagement here is that folks at the state and federal level will be continuing to look at policies that help ensure more individuals have access to coverage, and small businesses are a key component of that, given the fact that if you work at a small business, you have maybe a 50-50 chance of having access to employer-sponsored coverage. Those who work at a business with 100 or more employees, it's almost a 99%, maybe nearly 100% chance that your employer will offer coverage. And part of that is because of the ACA employer mandate that is applicable to those larger employers. But rather than creating a mandate for small employers, the state and federal governments are looking at a different path by creating a tax incentive to get them on board with offering employer health care. So one of the key vehicles that is moving the action on the federal side is the Budget and Reconciliation Bill that passed the House last month, known as One Big Beautiful Bill Act in the House. That bill included a number of provisions specifically related to ICHRAs and which are specifically designed to create a more stable, a more flexible, and more attractive option for employer-sponsored healthcare via an ICHRA. So it does really three things. One is to create the employer tax credit, which we discussed, and that's up to $1,200 per enrolled employee for the first year that a small business would offer an ICHRA, and then up to 600 per enrolled employee for the second year. And it's calculated just by the amount of months that a individual employee has been enrolled in that ICHRA connected plan. And so $100 per month, totaling 1,200 maximum per year per employee. The bill also codifies the 2019 regulation. We talked about the birth of ICHRAs being really from executive order. Ultimately, the Departments of Labor, Health and Human Services, and Treasury all got together and drafted a rule that would create this opportunity for small businesses or businesses of all sizes, really not limited to businesses just under 50 employees, but anyone can use this. That's one of the special features of an ICHRA is that unlike other tools aimed at offering incentives for coverage for small businesses, ICHRAs can scale with the employer as it grows. There's no limit in terms of the number of employees that can be offered an ICHRA. And so for that reason, we've actually seen rapid adoption at all levels of business sizes, including applicable large employers, those who have they're subject to the ACA mandate. That is actually the fastest growth segment for ICHRAs, as you can see from the chart reflected here in purple. It reflects the growth of the larger employer segment. So back to the legislation currently pending. In addition to codifying ICHRAs and creating the tax credit, it does upgrade ICHRAs to some extent by offering some more flexibility. One feature, for example, is that the federal law would allow for businesses who already offer a small group plan or want to consider a small group plan. They can offer that small group plan to the same class of employees that they offer in ICHRA and give the employees a choice between the two types of benefits. And today's version of the ICHRA rule doesn't allow for ICHRAs to be offered alongside any version of a group plan. And so that does create some more flexibility and potentially an on-ramp for experimentation for those businesses who already offer small group plans to their employees. Of course, many of you know that the small group market is relatively shrinking compared to other benefits opportunities like ICHRAs. And so it is harder and more expensive for small businesses to offer small group plans just because of the lack of access in the concentrating market. But ICHRAs provide an alternative that is more costly and essentially more flexible for both the employer and employee. All of these changes stand to take effect by the end of the year if passed. And that means that there's a potential for businesses who are planning for benefits year 2026 to incorporate ICHRAs as part of their strategy and be able to take advantage of the legislative changes, including the tax credits. Congress is on track currently to pass the tax and budget package by the end of July at the latest. Current target is actually July 4th, but the hard deadline really is the end of July. And the package may undergo some changes, but we're actively advocating for inclusion of the ICHRA tax credits, and many in the industry are doing the same. And we do expect that at least those provisions in the bill should be preserved, given the relatively low cost of offering these credits versus the ultimate cost savings that the government would achieve by shifting folks away from government subsidized plans and onto employer sponsored coverage. I'll pause there for questions, and otherwise we'll turn it back over to Gary or perhaps Patricia next for the demo.
Yeah, I don't know if there's any questions we can answer really quick.
So I have a question that isn't in the chat. Small business plans, you have to have a minimum of 2 employees who are actually take a small business traditional insurance, to be in a small business plan. Does an ICHRA have those same requirements?
I think what I heard was you were cutting out a little bit there, Lisa. Apologize, but I think you were asking if there's a minimum number of employees that need to participate. And yes, there has to be at least one employee for participation in the ICHRA. And I think that excludes the business owner. I'll provide some clarification on that over email, just to make sure that I'm not leading you astray. But my understanding is that it has to be the business owner and at least one other employee to offer the ICHRA too.
Okay, thank you.
Yeah, and so before Patricia jumps in, just one other thing that's important to the business of chambers. The other thing that we've done at Thatch is, similar to working with either an association. I know a lot of the chambers have chamber health plans, and those revenue considerations are very important to the chambers. We've also established a referral model specifically for our chamber relationships that is very similar to what the carriers have historically put together. I also think it's really important that everyone knows that I tell everyone, we want to be really good carrier partners. And the reason for that is because we want the carriers to build more networks and to continue to build more products within the individual space. And so the way that we've approached them, for example, we continue to meet with HCSC. We're fully integrated with the Anthems of the world. We have an incredible relationship. We're fully integrated with like United Healthcare. We want the carriers to continue to build better products and solutions in the individual space that are a better representation and more aligned to group products that have built over the last several years. And so, if there's any follow-ups around like what that revenue and referral model looks like, we've been having a lot of those conversations. We'd be happy to have those with any one of you guys. And again, we work with brokers as well, so that same revenue model would work the same way that you would work with a chamber plan, with an incumbent broker, and in working with a local business to bring together a solution. In this case, it would be an ICHRA model. So we're very nimble around that space, and so if there's considerations there or questions, we'd be happy to answer those in the future as well. So, Patricia, you want to bring this to life for everyone so that they can kind of see the way that the employer quote world looks like today and how we kind of pulled together all these individual plans.
Yeah, I'd be happy to. So I'm going to share my screen. And what I'm going to do is walk us through an example business that connects with a member of the sales team at Thatch or is evaluating how do we actually figure out what to give to people? How do we actually figure out how much to give to our employees? So the core of ICHRA is the actual monetary offer for benefits, for health insurance benefits. But how much money do you give? And especially when you have people potentially in a regional distribution or across other parts of the country, or even with price differences for a state or for employees based on their situation. So we're going to walk through an example company, and this is actually our product, the same process that any business would go through. And what we're going to do is upload that company information. Now, in this case, I'm uploading a census file, and a census has a list of all of their employees with their name, their date of birth, where they live, how much they earn, and then also information about the current benefits that are being offered. And we use this information because, one, that's going to inform the potential price of the plans that will be offered for an employee. And then it also helps us gain an assessment of the comparison when we look at plans. And in this case, our company that we're looking at, Heritage Construction, they do already have health insurance, and they have an HMO plan, and we're just going to use some example numbers here of the deductible and out-of-pocket max. And what we have next is two different options and two different paths that a company can go down. So for some small businesses, they'll know exactly what they're looking to spend. They have a set price in mind per person. And in that case, it probably would just be easiest to set a flat budget and say everyone receives $500 a month, everyone receives $1,000 a month, according to the business needs and the certain case that they have. But what we've seen work best is actually what we refer to as dynamic budgeting, where for a company, they're looking to give parity of purchasing power to your employees who are in different places and who have access to potentially different plans, but that they're still able to access the same level of plans, even though they're in a completely different area. And so we're going to take a look and see of how that actually looks. And the first thing that happens is that what we do is actually give a recommendation of what kind of benefits should we even offer when we look at your current existing profile. And so in this case, we're looking at an annual per year spend. The company's spending $406,000, and we've already estimated that they can save about $150,000 while having an approximate equivalent plan on the individual market. And so what I'm going to do is go ahead and click Customize, which now takes us to how do we really make an assessment of what kinds of plans to offer. And I'm going to zoom out a little bit here. And please, if you have any questions, please feel free at any time to raise them. What I'm going to do is walk through the different parts of the page, and then we'll go in depth on them and look at some of the different examples. So the first thing is that we have the map that shows where the business is actually located. So in this case, solidly in the Midwest, we've got a handful of employees across different areas. We can click to filter and see just those employees in a given location or given area. Over on the right-hand side, we have the total cost to the company and how much they would be estimated to spend, how much they would be contributing, how much their employees would be contributing, as well as a comparison against what they're spending today. Right below that is our checklist that we've established to make sure that the benefit offerings match the ACA affordability requirements, to make sure that there's no risk of potential penalties, and then as well as setting fair allowances. And so when you come to Thatch, what we're able to do is ensure that the allowances and the budget that's been generated is compliant. So that can be abstracted away. Then down below, we have a list of the employees. We have where they're located, their home base, the cost difference from what they will pay and versus what the employee will receive. And so in this case for Eamon, what's happening is that the employer is actually saving $1,400 a month in this example, and the employee is saving $18 a month for the same plan, for roughly the same plan. Again, this is going to be the equivalent plan that we found on the individual market. And then finally, over on the right-hand side, we have the different elements that we're able to adjust to help find the right price point for your business needs. And so in this case, we're covering about the median cost of all silver plans. And for this example, I'm going to increase this and make sure that we want people to afford really a majority of the gold plans in this area. And we'll see of what that breakdown is on a per employee basis. I'm also going to set the cost sharing. We'll set that to 80%, and then we'll set dependent coverage to 50% for each dependent. And so here we can see some of the differences as they impact employees, and then as well as the price differences per region. And you're able to adjust, you're able to increase or decrease. But really what the point is that what ICHRA does is it gives you, the employer, it puts you back into the driver's seat over the costs, over costs for benefits, over potential changes year over year, and also of what risk profile makes sense. And so now I've gone through and I've set this budget. And what we can actually do is then start to look at what is the impact going to be on a per employee basis. So we see that some employees are going to pay more, but for the most part, most employees actually would probably pay less and could be saving money. And what I'm going to do, I'm going to go ahead and pin some of the employees who I know I want to take a look at and review and check. And so now we're going to look at Blair and see what plans are available to her. And in this case, we actually see that Blair has almost 100 plans that they're able to choose from. And now it's a lot of plans. It's a big decision to be made. When people actually go through this process, we work with those members, we work with these employees to help them understand what plan is going to be best for them. And so part of this process is also helping understand for people, what are they looking to do? Are they looking to use a lot of health insurance? Are they not really looking to use quite a lot in the coming period? And then what's important to them? Is it having just a safety of mind of knowing that the coverage is there or key doctors set? And so even though this is a lot of plans, what I want to say is that actually this is the power of ICHRA, is that it gives employees the choice to make those decisions that are relevant to them. And in this case, what we can see in the case of Blair is that she's actually able to get a silver plan from UHC and have almost $300 a month left over that she's able to use for co-pays, for prescriptions, for any other qualified medical expenses, for the things that are important to her and that she's probably paying for out of pocket anyway. And so from that element, we can see and go through the other employees as well of what that impact is going to be, of what makes sense for the business, and then from there, at that point, from there, Heritage Construction would then approve this, set up their account, and then the rest is automatically handled so that you as a business don't have to go through the process of administering a health plan, enrolling people, following up. That is now becomes the opportunity for individuals to really take on and take those next steps for themselves. I'm going to pause right there. Oh, go ahead, Gary. I saw you come off mute.
Oh, nothing. I was just going to follow if there's any questions.
I just wanted to give a quick follow-up to Lisa's question earlier about the minimum number of employees. The answer I gave is accurate. That there is no minimum number of employees. You have to have at least one W-2 employee. It's not not available to self-employed owners. But and there's an important caveat there is that when you start to work with different class sizes, say if you have a group of part-time employees and a group of full-time employees, and you want to offer a group plan to one and an ICHRA to another class, there are certain minimum class size restrictions that do apply so that you can ensure that employers are not just offloading risk to the ICHRA, for example, but they have a certain minimum number of employees that they would segment for that ICHRA when they're offering a variety of different plans to different classes. But the threshold number, though, for anyone who wants to offer an ICHRA is at least one W-2 employee.
Okay, so I always think about our local chambers whenever we have these conversations. And so a local chamber whose employer is a board of directors, they're not going to be on the healthcare plan of a local chamber of commerce, but with only one employee, one W-2 employee could qualify then for an ICHRA.
That's right. Yeah, exactly.
Thank you.
That's correct.
Yeah, so we wanted to leave enough time. We've had some meetings that actually gone all the way time because there were so many questions. This is a little bit quieter of a group. And again, this is, we hope this was educational for everybody. We know this is very new. This is going to be a little bit of a journey, but obviously with the tax incentives that we're going to be voted on here pretty soon, we want to make sure that we get in front of all of our chamber partners around how that's going to transform business in your guys' community, especially starting with small business right out of the gate. And then obviously continue to provide some counsel to the businesses around, those tax incentives. Again, if there's discussions that the chambers want to have around things like revenue models and that sort of stuff as well. We just want to make sure that we are providing you guys with much either educational opportunity or clarity or anything else that will help you guys provide better counsel to the businesses in your community. So we don't have much more than that, Lisa, unless there's any follow-up questions, and I hope everyone found this valuable.
Thank you so much. I don't see anything in the chat, but for the folks who are on the call, do you have any questions that any of the folks can answer? If not, we will be having them join us at Fall Conference. You'll be able to speak with them in person about this, and I know that we would be happy to hold another call with you for more questions in the future.
Yeah, I'm sure as soon as the federal legislation gets baked, at least a lot of the requests have been as soon as that gets baked for us to do a follow-up conversation. I'm sure we're going to be super busy, but we're looking forward to those discussions as well.
Okay, great. Thank you. Yeah, that would be great. Well, thank you everybody for your time today. Again, this meeting's been recorded. I will go ahead and send out the recording in probably tomorrow or early next week. And it'll also have Patricia, Bruce, and Gary's contact information in it, so you'll be able to reach out to them directly. Although you do also have it in the calendar invite since I put everybody in there. Anything else from the three of you?
I appreciate it.
Well,
Thank you
great.
for having us.
Thanks so much.
Great rest of your day, everybody.